Um, as Dr. Guimarino said, my name is Christelle KOMLAN, and today, with my colleague Erin, we present our study titled School Garden and Nutrition Education for Healthier Diet in Benin, Impact Assessment and Key Lessons. So, our presentation will follow this step, background, objectives, intervention, method and data, result, and we will end with the conclusion and some policy recommendation. So to begin, I want to say that this study responds to an important nutrition challenge in West Africa and particularly in Benin. As statistics, we have an estimated 19% of the population in West Africa which is undernourished. We have 31% children under 5 stunted, which are stunted in West Africa. When we go down, we take the case of Benin. We have 9.7% of children which are stunted. We have 54.6% of children suffer from vitamin A deficiencies. Some surveys on infant and young child feeding practices report low dietary qualities, from which we can notice that only 9.3% of children achieve the minimum acceptable diet. So we can also notice that diet of infants and young children in southern Benin are often characterized by enriched porridge. So this poor dietary pattern undermine, unfortunately, survival, cognitive development, academic achievement, and healthy growth, while increasing susceptibility to infection. So addressing this problem combine supplementation and fortification of key micronutrients with food-based strategies that raise dietary diversity and improve nutrient availability through better preparation and use of locally available foods. So, school garden, especially when they are paired with nutrition education and community engagement, offer a promising food-based strategies. From Bliznaska and all, you can see these pictures which highlight global distribution of intervention comparison, which aim to improve fruit and vegetable intake. We notice that a lot of interventions were implemented in high-income countries and some in middle countries. From this intervention, we have rigorous evidence we show that garden-based programs can increase children's vegetable intake, knowledge, and preferences, particularly when programs included structured support and experiential learning and engaged families. However, in low-income countries in West Africa and particularly, we notice that rigorous evidence remains sparse. A small number of trials have produced mixed results, and only one cluster randomized trial in West Africa report no increase in fruit and vegetable consumption, pointing then to resource constraints and the need for broader community-linked intervention. This study addressed then two key evidence gaps. First, it evaluates the added value of an enhanced support package in schools that already had garden to test whether prior exposure strengthened engagement and program effect. Second, it employed a purpose-designed questionnaire to capture children's preferences, attitudes, and knowledge more sensitively thereby improving the ability to detect behavioral changes. The third one is to understand beneficiaries' perception of the intervention effect on nutrition knowledge, good agricultural practices, and healthy dietary behaviors. The theory of change for this intervention is based on the idea that the provision of training on gardening and nutrition with the necessary inputs and equipment will enable schools to grow more vegetables and directly improve children's diet by supplying more fresh vegetables to the school canteens and more generally raise children's interest in growing and eating vegetables. So that we create that will lead to school level outcomes such as improve children's diet at school, increase interest in growing vegetables, increase interest in eating vegetables, and better understanding of the importance of vegetable and other healthy foods. As we know that children share what they learn with their family, at the household level outcome, we will get children share learning with their families, children act as agent of change, and also healthier eating is promoted at home. So these school and household effects are expected to support long-term impact, improvement, and dietary behavior and reduce malnutrition. So based on that, our intervention, we develop training contents, we select school, we supply school of equipment, agricultural input, and seeds. And also we did weekly training, theory and practices session to teachers, school children, school garden committee, and parents. So to understand better the impact of our intervention, we did a mixed approach method, quantitative method and qualitative method. The quantitative method helped us to quantify the impact of the intervention on knowledge and food intake. Our qualitative method allowed us to assess the implementation of the intervention, including the school participants' experience and the condition of sustainability. About the school selection, 20 primary schools were selected. We have 10 intervention schools and 10 match control schools. All schools had World Food Program supported canteen and have existing school garden. Our final sample is composed by 20 schools, 884 school children. All of them has grade between 4 and 5, and the age approximately are 8 and 11 years. Sorry. Our baseline starts in February 2022, and 1 year after we did our end line. This is a quasi-experimental design which was implemented with our school to evaluate quantitatively our intervention. We have two types of outcome. The first type is the primary outcome. Our primary outcome is the frequency of children fruit and vegetable consumption. This primary outcome was measured using a simplified food logbook. These measures were administered monthly to the children precisely on the first day of each month, using a 24-hour record format. So for that, children were assisted by trained teachers and report all food and beverage consumed the previous day. particular attention, we put a particular attention to occasions that include fruit and vegetables. Response converted to frequency score that allow us to have the number of time per day the child consumes fruit or vegetables. As secondary outcome, we have agricultural knowledge, nutrition and wash knowledge, attitude and preference towards fruits and vegetables. And also, we collect data on socioeconomic covariates. So, to evaluate the impact of our intervention, we use difference and difference that allow us to estimate the average treatment effect using group, period, and interaction terms. So I will let Dr. Irene present to us the method using for the qualitative assessment. Thank you.
Thank you. On the qualitative assessment studies, we use a qualitative study using tools like interview guides and audio recording. We organize focus group discussion. We have 20 focus group discussion that involve school children that we are target under this intervention, parents, and school content committee. We have also the key interviews with participants who are the member of content committee for in-depth interview. About data analysis, we'll use Atlas T software, Excel, and also R for some quantitative data. What are the data we collect under this qualitative study? The topic of discussion focus on pupil knowledge of good agricultural practices and also on nutritional knowledge, mainly healthy eating, food group, and balanced diet. Also, the topic are focused on the food practices in school canteen, the change in the consumption of fruits and leafy vegetables at school and household level, and also challenges in ensuring the sustainability of school garden under diagnostic tools.
Thank you, Christelle. Thank you, Dr. Irene. So let's then present the results. So about the quantitative finding, the main result is that the intervention marginally increased children vegetable intake by about 0.93 times of eating, which correspond to an improvement of 37% over baseline with a p-value of 0.05. By contrast, fruit intake did not significantly increase. However, as we can see here, as you can see here, the intervention produced strong and statistically significant effects on several secondary outcomes, these outcomes. So the key takeaway that I want you to have in your mind is strongest gains were observed for knowledge-related outcomes. Vegetable intake increased, while fruit intake showed no significant effect. And we have large improvements were found for good actual practices and nutrition and health knowledge. So what about the qualitative results?
Excuse me, Guy Marino here. Sorry, quickly. Just a gentle reminder that we have about 5 minutes
Yes.
left.
Okay.
Thank
Okay,
you.
thank
Thank
you
you.
very much. So about the main result in the qualitative study, these studies, qualitative studies to more explain the quantitative result that show my colleague Christelle. As a quote, we have under this study before the project, we ate vegetable once every 15 days or once a month. But now the children eat vegetable every week, whether they are leafy or fruit vegetable. And this is a testimony of one principle of targets two. Another quote is from Mother's Cooks. She told, with the garden, there is an availability of vegetables, peppers, and tomato. The money we collect from the student for vegetable is used now to buy fish, which make the money more interesting and the sources as tasty. We also establish the network, which is the result from relationship between the different codes and allow us to understand the different factors who impact the increasing leafy vegetable consumption at school canteen. And as you show this network, we have improved basic nutrition knowledge. We have also improved quality of meals and also improve culinary practices who together help to improve leafy vegetable consumption at school canteen. Go, Christelle. What happened at household level? As coach we have when I was taught about gardening, I experimented at home with my mom. And now I can eat vegetables and Maslow whenever I want. This is a testimony of one student. We have one parent from another target area who told the children have knowledge and come to experiment it at home. They also try garden at home. One they find jute mallow and amaranth seeds, they scatter them in the garden. So it is much easier to eat at home now. Also at the household level, we establish a network who show that there is a most of factor, multi-sectoral factor who influence improve leafy vegetable consumption at household level. Among these factors, we have the establishment of home garden, improving availability and accessibility of vegetable, increasing knowledge sharing between children and parents, and also the reduction of cooking time, which is the effect of cooking training with mothers and cooks. Christelle, and now start. You can go, Christelle.
Okay.
So, what changed? As implication and policy practices and equity, we can notice that we have integrated garden with meal, link garden production to content meaning so that experiential learning to reinforce for actual consumption of food. The second one is the use garden as learning platform, embed garden in nutrition across subjects. Teacher training and sample material can help to sustain this integration. The third one, it is the involvement of local engagement through family and community. This makes sustainable all of the results. And the last point is to build equitable supply system. School garden alone cannot meet daily needs in large schools. Complementary procurement from nearby farmers can improve dietary diversity, but it requires financial support. Overall implication, we can keep on our mind that multi-sectorial approach is very important to provide balanced diet to children at households and school level. Move, Crystal. So we have some limitation, and between these limitations, we have short follow-up. Impact was measured after only 1 year, limited insight into long-term sustainability. We notice also that one single 24-hour recall is not enough to represent consumption practices. Mechanics remain uncertain. The data cannot show whether increased vegetable intake comes from school meal or home meal or both. Meal-specific intake data will help strengthen this interpretation. And for limited external validation, we can say that the sample came from Wood Food Program that supported school feeding program in Benin. Thank you very much for your attention. Your questions, comments are welcome.
Thank you to our two speakers, Dr. Irene and Ms. Christelle, for this insightful presentation. We will now move to the Q&A session. And please feel free to raise your hand or post your question in the chat. Thank you. Yes, Luca, please.
Hello, can you hear me okay?
Yes, we can hear you.
Okay, thanks for a good presentation. Yeah, I'm curious about the school gardens, as they are usually quite small and rather for educational purposes. So did you also measure how the food supply from school gardens have changed after the intervention? And with limited resources, what would be most strategic to focus on in Benin in next phase? Is it school gardens, home gardens, or education after your experiences in case they will have limited resources? Thank you.
I think we will answer the question as they come. So, Christelle and Irene, the floor is yours.
Okay, let me start, and Irene will add some things about how the food supply. If I better understand, if we have a change according to the food supply. Yes, this is what the qualitative assessment allow us to notice. We note if there are one code, for instance, who say that the number of time that they supply vegetable in this school change. So we think that yes, our intervention changed the food supply at the school level, but we need, this is one limitation that we highlight in our study, also in our presentation, is if we do more follow-up, that we strengthen or that we give more rigorous, let's say, rigorous assertion or rigorous yes about that we have a change in the food supply. So this is what I can say. So I don't know if
Yeah, I want to add,
yeah.
thank you, Lucas, for your question. I want to share with you that the target school are select with World Food Program, and these schools are under school feeding program. And World Food Program basket provides most of energy food like maize, rice, beans, salt, and oil. So you notice that there is any vegetable in this food basket. And so when we establish school garden and we add also good agricultural practices and nutritional knowledge by train, training mobile cooks about how to preserve nutrients during the cooking operation, we can have these significantly change under the diet they provide to school students and the significant result change we have in the diversity score we receive. Thank you very much.
Thank you both. Lucas, I hope they answer your question.
I think that we have it remain one question about home garden, school garden, and something like that.
Yes,
So
Christelle. I saw Piran question. Before that, I have a commentary. I noticed that stunting prevalence you report in your, I don't know, first few slide was 9.7 stunting prevalence among under 5 children, which is quite low, or lower, I should say, than the national
No, yeah,
estimate.
yeah,
Could
it is an
you
error.
clarify? Sorry, could you
It is,
clarify?
it's not, yeah,
Please go on, Irene.
yes. I think that is an error.
Oh,
Currently, stunting is not like, it's not low. It is 32. Okay, we will
okay.
change it.
Thank you
Thank you
very
very
much.
much.
Okay.
Yeah.
Now the next question it's from Piran. She's thanking you for sharing your study, and she said that you've shown a change in attitude toward fruit and vegetable. And she's asking which part of the intervention do you think must help improve it? Anything specific to your cultural context?
Can I go?
Yes, please, Irene.
Okay, thank you very much. The part of the intervention who have this significantly change, it is focused on the training, okay? The training of school students, and we use the approach of playing by learning, okay? Playing by learning because we set a kind of tools and we design the food group and also how to combine this food group to make balanced diet. So under class lesson, when we train children, they use these tools, okay, by playing, but also by learning. So it is very easy for them to keep in mind the key lesson about nutrition knowledge. Thank you very much.
Thank you, Irene. I hope that answer your question, Piran. I see Ndaniku his hand raised. Yeah, please. Thank you. Go on.
Okay, thank you very much, Guy Marino, and thanks to Irene and Christelle. This is quite an interesting topic, and yeah, mine is a comment, but also a call for further reflection on how to make these whole school feeding programs more sustainable in terms of integrating vegetables into the meals of the children. So when we read the recommendation number 4 in one of the final slides, it is clear that somebody has to pay for the vegetables that children will consume at school. School gardens alone will not be able to cover all the demand for these children. So in that case, the call for reflection is beyond the school garden themselves. How do we build a more sustainable value chain? I read that there should be a complementary production from surrounding farmers to supply the schools. So what should be the perspectives in terms of, there may be some policy actions to come in there. For instance, encourage or advocates for public procurement. I think at World Veg, we have been putting that ideas forward for a long time, but we need to make one step further to test probably, or to pilot how to incentivize policymakers to take strong decisions that will encourage the inclusion of vegetables into the basket that is actually, how do we call it, subsidized by these school feeding programs. So these are just some ideas for us to think together in future projects. How do we include those components so that we make the whole thing sustainable? Thank you.
Thank you, Ndaniku. Irene, Christelle, do you have any comments, answer?
Yes, thank you very much, Danku, for your intervention. It is a very relevant comment. So in Benin, I think that you have one opportunity. Nowadays, school feeding program is recognized for our government in our national policy food nutrition. And government also is ready to make universal the school feeding program for all the primary school in the area of Benin. And nowadays also we have World Food Program who starts a piloting project by cash transfer. And under this pilot project, with the cash transfer, they allow school to have a kind of link business with the surrounding farmers who produce vegetables and also a rice, eggs or meat. So under this advocacy, we also encourage the use of this cash transfer also to buy a lot of vegetables and fruits in order to make more balance the diet served to the school student meals. Thank you very much.
Thank you,
Okay,
Irene.
I want to, yes, please.
Okay, go on, Christelle.
Thank you. I want to also add some things very important. Daniku's highlight this also. Even we have a business, how to say, business network with between school gardens and farmers, or between school and farmers and all of these kind of things. It's very important also to put school garden, if we want to take into account as policy message, to put school garden as educational platform. So I think that will be more valuable and can contribute to healthy diet. Because as Irene also said earlier, this is when we train children to how to produce vegetable, we train them about the importance to eat healthier diet, all of this kind of thing that stimulate the preference to consume vegetables. So this is all the system that we need to work on that if you want to achieve better outcomes. Thank you.
Thank you. I have a question we still have a few minutes. So your finding show promising improvement in knowledge and vegetable intake, right? But how feasible is it to scale this integrated model, where we link a school garden to school meal and also at the household level, but this time across school that do not yet have canteen or the support from the World Food Program? How feasible is this? You have any idea?
Thank you for your interesting question. Yes, I think that that's raised one of our limits about the external validity of our study. We just focus on canteen or school which are supported by World Food Program. So that means that they already have school canteen inside, and also they have their own gardens. So if we want to, for the sustainability of this case, I think that what we said earlier match with if you want that this kind of school will be more sustainable. Our previous discussion about what Daniku raised match. But if you want to take the case of school which don't have gardens and don't have school canteen, if we want to get some effect, it is important to bring this system. Which system? This school has to implement garden inside in there. Have to implement garden first, and also to be involved in the school feed program. And I think that Irene just said that in Benin, for instance, most of school are already involved in the school feeding program. So that is the good point. So now it is to create the change by bringing them to have their own school gardens, and little by little, maybe we can get what we have in the case of school, in which we have school canteen and school gardens. If I don't know if Irene have something more to add.
Yes, to add something that under this intervention, one of the bottlenecks to make sustainable also the intervention, it is important to involve extension agents in the process, because we know teachers are not agronomists, and during the school garden, they are facing for pest and disease management concern. So during the scaling up of this process, it's very important also to involve extension service who are mainly close to the target school. And the criteria of the selection of school is very important. We are able to select school that have school canteens, because the school garden output, it is for the use for the cooking or for meal served to a school student. So it is very important, this criteria, during the scaling of this kind of intervention. Thank you very much.